I do remember that press conference, and I was going through my emails too. We were starting replying to some of you who were asking questions as of January 2nd. Next question is for Karen from World Health Alert Crisis. Karen, can you hear us?
Yes, I can. Can you hear me?
Yes, please go ahead.
Good afternoon. My name is Karen Wolfson from the World Health Alert Crisis. I just want to say the World Health Organization is doing so much to support countries through the COVID-19 pandemic and other diseases. I want to know what individuals, companies and organizations can do right now to help protect those who work for the WHO, who are doing such wonderful work and show, in my view, so much humanity. And I want Tedros, Dr. Ryan and Dr. Kirkova and all of your colleagues to know how much gratitude so many people in the country, in the UK, where I am from, and all over the world have for all of you. Please remember that, please. I want to also just add quickly that, as Tedros says, unity seems more important than ever. And I've actually discovered I normally write news and analysis, but I've also discovered a very big issue after looking at a massive data from cities worst hit around the world by COVID-19. I've discovered these cities all have exceptionally high humidity levels, rising temperatures and carbon dioxide at very high levels during their outbreaks. And I am not a climate person, but I've actually alarmed and now believe this is to do with global warming. And I've uploaded as a result the study to YouTube for everyone to read and maybe add to, because I've realized that perhaps there's a much longer term issue that the world needs to address to reduce humidity and pollution, to help reduce the risk of triggering more disease, because I understand, I'll just continue a little bit, that COVID-19 appears to be triggered, or not the onset, but the outbreaks by wet and humid conditions, very much like malaria. But my question really is, what can we do to help you? Because I would like to create a human shield around you, but that's not possible. And I want to know if there's anything the world can do for the organization that is guiding us. Thank you.
Thank you very much, Karen, for these nice words.
Yes, thank you very much. I think what we need in WHO, like so many workers around the world, is the space, the support and the solidarity to do our jobs. And there are so many thousands of brave frontline workers all over the world doing that today. Our solidarity is with them, and we thank communities and others. Some specifics: companies, organisations, everyone's, DG has spoken about this, everyone's involved. This is all hands on deck, all hands on deck. Today, this Director General was in a meeting with World Economic Forum business leaders, talking with them about how they can contribute. We're talking with vaccine manufacturers, we're talking with supply chain managers, we're talking with companies in the pandemic supply chain network around stabilizing supply chains for supplies and everything else. We're talking to producers of medical oxygen. We're talking to people who make ventilators and who can adapt technology for use in low resource settings. This is a moment where the public and the private sector, there is no public, there is no private sector. There is a combined effort to get rid of this virus. And everyone has something to bring to the table. Everybody has something to bring. We try to not control or direct that. What we try to do is create the forums, to create the convening power, to create the mechanisms by which others can innovate, others can be successful. And we try to direct that energy in the best possible way through good policy making and using science to drive what we do. Science, solutions and solidarity. With regard to climate, there is no question that climate and climate variability is driving infectious disease risk around the world. There are many diseases that are climate sensitive. We've seen outbreaks of cholera all around the world that are either related to flooding or related to drought. They're either related to too much water, too little water. We have literally billions of people living in peri-urban, poor environments. And in many ways, unfortunately, those populations are almost like kindling for a fire, and not just a fire of COVID, but any other number of diseases in future. We can't afford to leave people in overcrowded, underserved conditions in such densely packed environments. This is a risk. It's not only a political and a social risk, it is clearly an infectious disease risk going into the future. Part of the reason that we can't eradicate polio so far is because that virus can become entrenched in those very environments. I was speaking about Pakistan earlier. Pakistan has had a real struggle in clearing infections from large urban environments. The direct impacts of climate on coronavirus incidents are not known yet. We simply do not know what the impacts of humidity, temperature, and other factors are on this particular virus. We do know that other viral pathogens are affected and often occur in seasonal epidemics. To the extent to which climate and humidity and other cold affect that are in some cases well known, in other cases not so well known. But in this particular case, we don't know yet. And quite frankly, I'd much prefer in some senses, never to know. I would prefer to get rid of this disease than have to wait around long enough to know. But we may have to learn how to live with this virus, and we will certainly have to learn how to control this virus in high-density urban settings.
Only to add to that, so Karen, thank you for your very kind words and for all of the kind words that we've received since the start of this. It's very nice to hear. With regards to humidity and temperature, and I mean, if you remember, this began in very cold temperature, very dry, low-level humidity, and we are seeing this virus have the capability to accelerate in a number of different climates. We need, as Mike said, we don't know how this virus is impacted completely yet. It's still new. We're still in the early stages of this pandemic in our 4th month, and we need to treat this virus everywhere it shows up as aggressively as we can so we don't give it a chance to take off.